Hi everyone, so I just wanted to talk a little bit more about bone health today. As I mentioned in my post yesterday, I think this is such an important topic for active females to be more aware of, so I wanted to give you some information here that I think would be really helpful for you. So first things first, why is this conversation important? So number one is that obviously we all want to be able to live a long, healthy life, especially as active women. We want to be able to live the active lifestyle that we love for a long time going forward. So we don't want to have to be dealing with injuries. We don't want to have to deal with early age osteoporosis or osteoporosis at all in our life. So this topic's so important because we can only really reach peak bone mass by the age of like 19 or 20. After that age, we begin to take away from our bones, and our bones can become weaker if we're not on top of our game with certain things. So that's why it's so important we don't continually keep building bone throughout our life. So that's why we really have to be conscious of it while we're young so that we can reap the benefits of that throughout the rest of our life. So what are some warning signs that you might want to check on your bone health? So one obviously is going to be if you have a history of disordered eating disorder, or even if you just don't tend to eat enough for your active lifestyle. I talk a lot about this on my profile, but not eating enough doesn't just always have to be the result of an eating disorder or disordered eating. It can also be that you're just really active and you have a busy life, so day-to-day things kind of fall through the cracks when it comes to refueling. It could be that you just don't necessarily know how much your body needs. So there can be other factors when it comes to not eating enough, more so than just disordered eating or an eating disorder. Also, a history of weight loss, and now you're trying to maintain the weight, so your caloric intake isn't necessarily matching your needs, can also be a big one that's really common. So this is one thing to take into account that could increase your risk for bone issues going forward. One of the biggest telltale signs to see if this energy balance is off is if you're getting a normal period or not. A normal period is a great indicator that you are meeting your nutritional needs. There's not a gap in energy balance. And also with every normal period, you basically get a deposit into your bones that helps keep them strong and keeps them healthy. So when you're not getting a normal healthy period, you're not getting that monthly deposit. So it can make the bones weaker. It pulls from the bones more often, which can set you up for bone issues going forward. So that's a big thing to take into account. And the other big topic that comes up with this is that if you're on birth control or if you are on an IUD, it's can be hard to tell if you're actually getting a real healthy period or if you're just kind of bleeding monthly because of the birth control or the IUD. So just something to keep in mind if you're out there. So other things that can put you at a higher risk for poor bone health are going to be, obviously, if you've been injured in the past or if you've noticed recurring injury, that can sometimes be a red flag that you want to take into consideration. Low BMI, also low calcium and vitamin D intake, right? So you obviously want to be eating dairy or you want to be eating a non-dairy alternative. So most non-dairy alternatives, especially if they're more like commercialized products, are going to have be fortified with calcium and vitamin D. So that's okay too. But if you have low intake of dairy or non-dairy alternatives, that obviously is not going to necessarily help you optimize your bone health. So it's something that you want to be conscious of when considering how healthy your bones might be. Genetics is a huge thing. Unfortunately, some of us are more genetically protected than others. Some of us can miss a period for a year or have abnormal periods for a year and our bones be completely fine. And some of us are in the opposite boat where maybe we don't have extreme dieting or extreme disordered eating behaviors, but at the same time, our bones are going to be more at risk for being not as healthy. So something you want to take into account if you have a family history of osteoporosis, if you have grandparents or parents who are getting injured a little bit more often than usual, that's something that I want you to take into account as well when it comes to navigating how healthy your bones could be. Also, the amount of activity that you're doing. We've all heard that weight-bearing exercises and exercise in general can be helpful to optimize bone health. But the biggest question is how much are you doing of it? If you are out there training every day and you're overtraining, this is actually going to be taking away from your bone health. So you really want to be conscious of that and make sure that your training level is supporting your bone health, not taking away from it. So when it comes to what to do if you fall in any of these categories or any of these warning signs or kind of what's going on for you, maybe consider talking to your doctor, talking to your primary doctor, talking to your gynecologist about some concerns that you might have, and you can have a conversation with them around, is getting a bone scan something that's worth it for you? Is it something that should be considered for you? Or is it something that's really low risk, you're probably fine, nothing to worry about? I would say that if you can check the box on any two of these warning signs, so I'm going to go through those quickly again. This is going to be disordered eating, eating disorder, or just low intake for any type of reason, high activity level, or kind of falling in the bucket of potential overtraining, not giving your body enough time to recover, history of injuries, low calcium or vitamin D intake in your diet, poor or genetics that puts you at a higher risk, low body weight. I didn't mention that the first time, but if you tend to fall in a lower range of the BMI, so anything maybe under 19 or 20 might be something that you want to take into account, and most of all, irregular or missing periods. So if you check off any of these like 2 to 3 boxes, I would probably consider just having a conversation with your doctor. Your doctor can point you in the right direction. Is this something that we should be considering, or is this something that maybe we can wait on a little bit? I got mine recently just because, as a dietitian, I'm super interested in this, but also in high school and even in my 20s, I have a little bit of a history of an eating disorder in high school. And then also I just probably wasn't balancing my food and exercise as much as I should have in my 20s. So it was something I was interested in. And the doctor agreed that as I get older, it's definitely something that we just want to make sure is not a concern, get out of the way. And I have to say, I was super impressed with how easy it was, how quick it was. It was definitely quicker than I expected it to be. It was like 20 minutes. So I would definitely say that if it's something that you've been considering or that you've been worried about, if your doctor agrees, then it's something definitely worth looking into. So also, one thing I want to note on the irregular periods, if you've only had an irregular period for like 3 months. I don't want to say only, like that's not a big deal, because that's still something that you want to be looking into. But that's probably not something that's going to start chipping away at your bone health to a significant degree yet. But if it's kind of been going on for a couple years, or your periods have always been a little bit spotty, then it's something I would definitely look into. But again, not to discount how important it is to always be getting a healthy period. It's not normal to get an irregular period, so still definitely be looking into that. You just might not have to go the bone scan route yet if it's just something new. So what to do in general aside from getting a bone scan, right? So making sure that you're eating in order to get healthy periods. Your periods are coming regularly. They're lasting more than 3 to 4 days every cycle. They're coming every 35 days or less. Also making sure that you're eating enough in general. You're compensating for the exercise that you're doing with enough calories and enough of the right calories to promote healthy bone status. And also within that, making sure too that you're getting enough calcium and vitamin D. Super, super essential. Like I said, this can be coming from obviously dairy products, but it can also be coming from fortified non-dairy products that are fortified with calcium and vitamin D. When it comes to exercise, making sure that you're doing exercise in a way that is supporting your bone health. Not too little, not too much, and making sure that you have some resistance training in there. Ideally 2 days a week can be really supportive. Last but not least is you can always consider supplementation, especially if you're someone who knows there could be some gaps in your diet, or who is just not very good with meeting dairy and calcium and vitamin D needs on a day-to-day basis. That can be a route that you might want to consider. But of course, always talking to a doctor or dietitian about what that should look like specifically for you. Obviously, it's going to depend on your specific needs and what you're already getting in your diet, and with vitamin D, what your day-to-day lifestyle looks like. So that's always something that you can consider. I love talking about this topic. Does anybody have any questions about this in particular? All right, so no questions. I'm going to save this video on my profile, but please at any time feel free to DM me with questions. This is such an important topic for any female, also males, by the way. Low testosterone can result in poor bone health as well, so always keep that in mind. This is also important for men and active men too. So if you have any questions, please let me know.